I'm a nurse. When nurses don't communicate well, patients suffer. Nurses are expected to have strong communication skills. We need it to give information to patients and family members, as well as communicate effectively with doctors and other members of the healthcare team. Strong communication skills are imperative to being a successful nurse. I need them because quality patient care relies on informative speeches, credibility, and avoiding information overload. First of all, strong communication is required to give informative speeches to patients. These speeches provide information the patient doesn't know or enhances their understanding on a topic with which they are familiar. Nurses use informative speeches to discuss side effects of medication, plan of care, treatment, and discharge instructions. It's also required to give consent for a procedure or surgery. Research has shown that communicating information in a way that patients understands improves quality of care and minimizes patient distress. I currently work on a postpartum unit. Teaching is an important component of my job. Just the other day, I had brand new parents whose brand new baby was going to need phototherapy for jaundice. These parents did not understand anything about jaundice or what therapy, how it would help. So I sat down and explained everything to them in terms they could understand. And this relieved a lot of their anxiety and fear, and they were able to just fully understand and ask me questions, and I was able to answer thanks to an informative speech. So I have explained why informative speeches are essential to quality care and patient satisfaction. Next, I will discuss how credibility facilitates the nurse-patient relationship and establishes trust. Credibility is when the speaker is qualified and informed to speak on a topic and demonstrates an expertise in that field. Credibility helps the nurse to gain the trust of the patient and family members, as well as earn the respect of coworkers and the community at large. A nurse gains credibility through education, experience, and ongoing training to stay up to date with the latest evidence-based practice. I got my ADN here from Cuesta College. I also have 2.5 years experience as a floor nurse. I'm in the process of getting my bachelor's degree, and I'll have it in December. I also had to pass the extremely difficult NCLEX exam to get my license. Because of these credentials and my experience, my patients trust that I am able to provide extraordinary care while they're in the hospital. I used to work on a telemetry unit with patients of varying degrees of illness. I had a patient about a year ago who really didn't have a lot of experience in the hospital other than when she gave birth to her children. She came in with lower GI bleed and was going to need a colonoscopy. She already had a trusting relationship with the staff, but still asked me about my experience with colonoscopies and GI bleeds. I decided to share with her that I myself have Crohn's disease and have undergone several dozen colonoscopies in my life. She was very thankful that I relayed this information to her, and I remember her thanking me and her telling me that she was relieved that she was in such capable hands. This demonstrates that credibility can be obtained through personal testimony as well as with education and experience. So now that I've told you why credibility is imperative to establishing trust between the nurse and the patient, I will talk to you about how to avoid information overload with the patient. When patients become overwhelmed with information, they can't process it and they can't make decisions. To avoid this, the nurse should narrow her focus to just a few essential points. She should be brief and simple in her explanations, and she should do it over a long period of time and not all at once. I have a really strong recollection of a patient who was overwhelmed with information to the point where it could have potentially harmed him. He was coming for a bypass surgery, and I was taking care of him the night before the surgery. He was becoming increasingly anxious throughout the night to the point where it was affecting his heart rate and his blood pressure, and he was sweating. I asked him what was going on. He explained to me that he just didn't want to go through with it anymore. He didn't know if it was worth it. Turned out he'd been given this thick booklet full of all this information regarding his recovery, and no one had really kind of broken it down for him step by step. He just had to read it all, and he became extremely overwhelmed. So I broke it down to the most essential points that he needed to know over the next few days, and then that we would go step by step, few days at a time, few days at a time. And when he got home, cardiac rehab would be able to pick up where we left off. He was relieved from that, and he went through with the surgery. This is a prime example of how information overload affects patients and could be potentially dangerous, and why it should be avoided. In closing, my goal was to share with you why strong communication skills are necessary for successful nurses to give excellent patient care. It's necessary because nursing relies on informative speaking, credibility, and avoiding information overload. You wouldn't want a nurse who couldn't explain the side effects of medication or what your treatment is. And you don't want to be cared for by a healthcare team who can't communicate with each other. The difference between a satisfied patient and a suffering patient is a nurse with strong communication skills. Thank you.